Well, coming up next, that's right. We have a doctor in the room. That's right. Make way for the Manhattan cannabis expert that loves to tell people all about themselves and the fact that they're hypocrites for wanting to all ban single source compounds. That's right. It is the Dr. Mary Clifton.
Hi, everybody. Welcome to High at Nine News today. Thank you for having me. I've got a very simple article. I don't even feel like I should read it, except for there are some great facts within it, but the headline really pretty much tells it all. New York bill is to require health insurance coverage of medical marijuana, clears the Assembly Committee. So, New York lawmakers have approved a bill that would require public health insurance providers in the state to include medical marijuana as a covered prescription drug and authorize private insurers to do the same. The Assembly Health Committee passed the legislation from Majority Leader Crystal Peoples Strokes in an 18 to 7 vote on Tuesday. It now heads to the Ways and Means Committee before potentially advancing to the floor. The measure would amend the state statute to define cannabis as a quote prescription drug, a quote covered drug, and a healthcare service for health insurance purposes. Medical marijuana would need to be covered by public insurance entities, regardless of the federal financial participation in their services. This would include state Medicaid, Child Health Plus, workers' compensation. EPIC programs would be required to treat cannabis from certified dispensaries the same as other conventional pharmaceuticals for the purposes of insurance coverage. Private health insurers, on the other hand, wouldn't be forced to provide coverage for medical marijuana, but the bill clarifies that they can if they choose to. The commissioner of the State Department of Health would also be authorized to certify a dispensing site as a medical assistance provider solely for the purpose of dispensing medical marijuana. And this final quote here: for thousands of patients, medical marijuana is a safer and more effective medication than other drugs, especially opioids, a justification memo attached to the bill says. While it can be prohibitively expensive for many patients, especially in the absence of insurance coverage, it may often be less expensive than what their insurance coverage pays for other medications. Cost is a primary barrier to patient access to New York's medical marijuana program. And then it just goes on to talk about some additional ramifications that are not particularly supportive of the whole idea. But moving to my opinion, I'm thrilled to see this come through. I mean, if we can get medical cannabis in as a prescription therapy and a covered benefit, then I mean, it should do nothing but save money because patients reduce their other prescription therapies. It'll save money for the insurance company. It'll save money for the patient, and it saves money for the government overall because a Medicaid or Medicare patient that's government insured is going to have fewer prescriptions, and be in less chronic pain. It also results in less diversion of opioids that are going to be used with less intensity when cannabis is added in higher amounts as cannabis is introduced as first line therapy for pain instead of as an alternative therapy when other therapies have failed. So the big losers are going to be big pharma because they're not going to be able to sell us all of the antidepressants and sleep meds and pain medications that they're selling us now at the levels that they are. And I'm Mary Clifton, coming at you from Miami, even though my fake pool background might suggest otherwise. Coming away from Miami, coming to you from New York, even though my fake pool background makes me look like I'm coming from Miami.